welcome everyone to this month's episode of MPS interviews that I've been doing. We all know I've been doing a series where I like to highlight members of the Maryland Psychiatric Society. And this month I wanted to highlight my colleague and friend, Armand Taghizadeh. It's good to see you, man.
Yeah, it's great to see you too. Thanks so much for having me.
Yeah, no worries. Well, thank you. So we know that this month I wanted to talk a little bit about sports. In large part, talk about the impact of sports in clinical care, the integration of sports into treatment plans or clinical recommendations. And clearly, there'd be no one better to talk about this topic than you, our premier sports psychiatrist in the area. So I wanted to bring you in just a little bit to talk about a little bit about what you do first and foremost, but then also talk about what recommendations you give to standard clinicians who don't have subspecialty expertise when they're talking about the impact of sports and the care that they're providing or the impact on the patients that they're seeing. So why don't we start with talking a little bit about you, what you do, what that is, why people use you. That would be a great place to start.
Yeah, absolutely. No, I appreciate it. So, a little bit about me and kind of how I've gotten into this field and why it ties together is I was an athlete myself. I was a former Division I college wrestler. And so sports has always been an important part of my life, but even particularly competing at, a very, very high level and the time, the dedication, the sacrifice, everything that goes into it, not just from like a physical standpoint, from a mental, psychological standpoint, all the adversity comes, right, with that. And so that's been important, and it's always been an important part of my life. I actually became a teacher and a coach after college, which not many people know about, but I was a middle school teacher and a high school wrestling coach. And so teaching and coaching has always been a big part of my life and my passion. And so even when I went into medical school and the medical field, trying to pick a subspecialty that allowed me to be able to teach and coach and connect with people was always on my mind. And that's really what I was drawn to psychiatry about. And so where I am at this point is I've been able to combine my athletic experience, my medical knowledge, my mental health expertise, and really has created this niche and specialty into sports psychiatry. Another thing that I think does set me apart from other people in this field, though, is that I still compete and train at a high level like a competitive athlete. So you and I were just talking about it, but I just got back from Whistler, Canada yesterday, where I hiked Blackcomb Mountain, a total of, 8 times 32 miles over 29,029 elevation, the equivalent of Mount Everest, and just got back yesterday. But Ron, the reason I do that is not just for my own self-fulfillment and sort of the physical challenge, it's also for the psychological and emotional challenge that it comes with it. And it allows me a better perspective of adversity on a consistent basis. And so why that is important to me is that when you're working with young people, and they're going through athletic challenges and they might have all the talent, skill, experience in the world, but they're getting stuck or they have some sort of adversity, something they didn't expect. It allows me an opportunity to better understand their experience today versus just drawing upon like my medical knowledge or my clinical knowledge or even what athletics was like for me 20, 30 years ago, which is very different, right? And I think that so many folks in this field draw upon experiences in the past and say, no, I know what it's like. I was an athlete 20 years ago, 30 years ago. That's very different than being an athlete today. And how does one truly understand? I can't go back and compete at a Division I sport, but I can certainly spend hours and hours training and go through an event where I might think I'm prepared, but I know very, very well that there's all these things are going to happen that I can't control and I have to figure out a way. So even the self-discovery that comes with it um, allows me to be a better clinician. And it also allows me a sense of relatability and integrity with folks today, right? Where they're
Yeah.
like, all right, I see you out there hustling. Like, how are you doing that? And I'm like, you're doing this, I'm doing this. And so that's a little bit about me and sort of how I've gotten into this field and how I tie it together.
Yeah. Kudos to you. I don't know about you, but the body does not rebound like it did when
No.
I was younger. So the fact that you're out there still doing it is pretty amazing. What do you say to folks like me or the typical clinician that is treating, young folks who are heavily involved in athletics or older folks too, and are struggling with issues related to their mental health, and how that's impacting their capacity to participate in sports, or vice versa. Like, I also see a lot of young people who are highly driven for athletics, and I worry about it then impacting their mental health too because of the intensity or the high level competition that they're at. So what do you say about to clinicians like us who are trying to manage that and also when to engage folks like you?
Yeah, no. So I think, look, when we're evaluating people, right, we're not just looking at them from a diagnostic perspective and the criteria that they meet and the checklist that they follow. I mean, we shouldn't be, right? We're looking at the overall person. And so, what is some of the barriers that are interfering with their ability to be successful or happy? What are some of the strengths that they have? What is their lifestyle, right? Like, lifestyle is such a big part of health and wellness, in any field, but particularly in psychiatry, because the things that we do, right, directly impact how we feel and how we think. And so when we're looking and evaluating anybody, right, we ask about habits, we ask about behaviors, we ask about community, we ask about involvement in other activities, things that bring them joy, things that bring them happiness. So I think in some ways, for any clinician, I think evaluating what are the things that our patients are doing, right, that either are risk factors or are beneficial, right, and sort of identifying that. The other thing that I think fitness and exercise and competitive athletics brings, um, that other things don't necessarily bring are, right, there's a sense of community, right? There's a sense of having goals or striving for things, being able to stay focused, right? Like those are important things. There's also, neurochemical benefits, right, that we know about, including dopamine and serotonin and oxytocin, right, just to name a few. But these are all neurochemicals that we often are treating with medications to enhance, to promote the ability to be able to be more active and engaged, right? There's the confidence that comes from these things. There's also, frankly, the humility in knowing I can get knocked down, but like essentially I can get back up again, right? And I
Right.
have to rely on myself. And so I think the role that athletic plays for anybody is understanding that there's a lot of value that it can have for any of us, right? And not just the physical benefits, but the psychological benefits. So I think as any clinicians, it's just important, again, I think evaluating the whole person and looking at ways that they can also improve their own health and wellness independent of medication, right? And so that would be the first thing. I think, again, like anything else, it's identifying the role that it plays, how important it is, and how they identify with it. So if we're looking at somebody that's identifying their entire life, sense of self, value, worth, career, profession based on sport, right? And when I say career profession, even as a collegiate athlete or high school athlete, if that's all you do and that's going to be the thing that's going to allow you to raise a family and be successful, and there's nothing else, then that's concerning as well, right? We want to help them understand how important it is and be able to maximize that, but also develop a sense of identity and a sense of self independent of that, right? Because there's a lot. So I think also understanding how not just how important it is, but like how they think about it, how they view it. Again, and I would say the same things. If you're evaluating somebody that is a physician or a lawyer or a first responder or whatever they are, and that's all they are, and their entire sense of self and happiness and success is based on success in that thing, that would be concerning. And that's something
Yeah.
we want to talk to them about developing strengths outside of that in a sense of self. So I would look at it in some ways no different than that. The difference, I think, with athletics is it's not, there's the physical component, there's all of the other things. Like our job sometimes is our job, and it's easier to say, look, you don't need to just identify yourself as a doctor or a lawyer or a firefighter or a police officer or a teacher. You have so much more. But as an athlete, it is your physical health. It is your mental health. It is your sense of community. So everything gets tied into it. And that's where it gets a little nuanced. Um, to your next point of when to refer somebody like me, I think is when you are starting to notice that it's really so tied in that it's hard to separate it out. And it's hard for that person to sort of see that separation. Or if you feel like, look, I see that this sport is really such a big part of it, it's limiting my ability to even engage with them as a human being. That might be something. And while it's not exactly the same thing, I'll sort of use the analogy of like an addiction, right? If you notice that the addiction is such a big part of that person's struggle, you may say, look, I want to refer to an addiction psychiatrist, right? Not that I don't understand the human and I understand things about addiction and I have a knowledge base, but this is really so a big part of who they are and why they're struggling that I really want to bring in somebody that maybe specializes more, understands it more, can communicate it about more, right? And that may be also something to sort of think about. The other thing that I would say would to consider would be is if somebody's has a significant injury, right? A lot of my referrals come from sports medicine providers or primary care providers where they have an athlete says, look, this person has sustained a severe injury. It might be a head injury, it might be an ACL, surgical, and now they're having trouble with recovery and they're realizing, look, there's something more than physical. And so potentially referring to a sports psychiatrist makes sense for that person because you're not saying to them, look, you had a physical issue and now you have a mental issue. We're going to go to like a psychiatrist. It's more like this is part of our sports team, right? And I know
Yeah,
this guy and I've got a relationship with him. And by the way, he's out there hustling. And I think it, it, I'm going to use a word we use a lot, but I don't like to use it because we use it a lot, but it like destigmatizes it, right?
that's right.
It
Right.
breaks
Makes it
this,
more
it
palatable for
makes it
them.
more palatable, right? And more relatable that this isn't like a typical mental health provider. This is an athlete. He happens to be
Yeah.
a mental health doctor as well, right?
Yeah. Whatever way you can pull people in, right? Even if it's, being a little tricky, I guess.
Sure, sure.
Well, thanks. I think that's a great explanation as to when we should reach out to someone like you. What should folks expect? Like, if a patient asks, well, what's he going to do differently? Like, what is it? How do the treatment services different, or what do they entail? What would you have us say?
Yeah, so I mean, in some ways, right, I'm looking at the person as a person first, right? So, they're a person and they're an athlete and they're a student and they're, all those things. So, in some ways, it is similar in terms of my evaluation process, right? My evaluation for athletes is very similar than my evaluation for quote unquote non-athletes, if you want to call it that. The difference is I do within that I spend more time on the athletic piece than I would otherwise, right?
Gotcha.
That's one piece, and then really getting into like how it's impacting them and how it's navigating. So there's a little bit more of a focus in the identification of that. From there, a lot of it comes down to the language, right? The way that I approach an athlete is going to be different than potentially somebody, and it's about meeting them where they are, right? I think that
Yeah.
most athletes, particularly at a competitive level, they've spent the majority of their life within that sport where people talk to them a certain way, right? Like there's a coaching element, there's a coach speak, right? Everything is kind of like, here's what you're going to like, here's what I see, here's what the problem is, here's what you're going to do. And so there's a goal oriented aspect of like, I need a plan. I need you to tell me what to do. I need the plan. I need you to tell me how to do it. So I think of it a lot like a strength conditioning. If you've ever seen a personal trainer, you've gone to a strength and conditioning coach, they look at you, they identify what your goals are, who you are, and then they create an exercise program that's very much dedicated towards you. While you might be doing similar or same exercises as other people, it's targeted a little bit differently, right? In terms of the reps and the sets and the order, but also in the way that it's communicated to you versus somebody else,
Yeah.
right? And so, like, part of it has to do with the way I package it and communicate it so that it becomes more authentic to that person and what they're trying to do. And again, I think a lot like a teacher and a coach. And so for me, when you ask me how's it any different, I would say it's not that much different because I treat my non-athletes the same similar
Yeah.
way
Right.
in the
Yeah.
way that I talk. And that's kind of who I am. But I think it also has to do with that ability to understand that a lot of these folks are not looking at it like I have a problem. They're looking at it like I want to get better. And that is a difference in mental health is, you know, with that in sort of outside of the athletic field, a lot of folks are coming because I have a problem. There's something I don't like about either myself or what's getting in my way. And for a lot of athletes, they're saying, I don't want to focus on the problem. I want to focus on not just the solution, but how to excel. And so taking that and being able to package mental health in a way that is more about performance and more about excelling in things versus getting back to quote unquote normal, right?
Yeah.
And that's a difference too. And so again, like you said, it's kind of like being tricky. Whether it's being tricky or it's meeting them where they are and
Yeah.
finding the language, and again, helping them see where are you trying to go and let me help you get there. And along the way, by the way, I'm going to be instilling things within you that are going to allow you to better recognize the things that are getting in your way and to be able to make mental health a little bit more palatable, to use your word, a little more relatable, a little bit more engaging, and maybe a little bit more like exciting about, wow, so if I actually address this piece, all of these other pieces are only going to get better.
Right.
So I think that's a big, big part of it. And then I think, again, with me too, having these relationships with coaches, right? Being in this area,
Yeah.
having been an athlete in this area, like I know a lot of these coaches. I know a lot of the sports medicine providers. So I think there's also connectivity of me being able to pick up and say, hey, coach, this is what we're going to do. And knowing, hey, coach is going to listen to Dr. T because they know Dr. T, they respect Dr. T. So it's not a separate part of like your psychiatrist, your coach, your athletic trainer. It's kind of, again, all part of like we're in the same room. And so I
Yeah,
think for an athlete, they're going to feel more comfortable knowing these guys all have my back and they respect each other. And for me, knowing that a sports medicine provider or a coach or an athletic trainer respects me allows me to be able to probably be a little bit more forthcoming, frankly, and be able to say, hey, I also think this is where you guys can make some changes. I mean, I've had conversations with coaches saying, hey, I think you need to change your approach with your athlete.
yeah, that's
And
right.
this is why. But again, being explained not just like this is what you're doing wrong, being able to help them understand if you want your athlete to be able to get to this level, part of it has to do with what you're saying and how you're saying it, because this is what they're hearing. And when they understand that, sometimes they're like, oh, like, okay, what can I do differently and why? So I think those are some nuances that make it a little bit differently, but
Absolutely. Yeah. I mean, it's care coordination. You just have a different team of folks that you're reaching out in order to coordinate the care. So
100%.
yeah, that's awesome. All right. Well, most importantly, how do people reach out to you if they have questions or they want to refer people to you?
Yeah, I appreciate it. So for, I mean, for the MPS community, I'm on the listserv, so you can reach out to me
Yeah.
there.
Love it.
Um, Within my kind of sports psychiatry brand, that's Mindset Training Institute. So you can go to mindsettraininginstitute.com. For my website, mindsettraininginstitute@gmail.com is the email. I also have a podcast, and the reason I highlight that is because it allows people to kind of see how I think and how I operate. So I'll have high level performers, world champions, Olympic champions, professional athletes. But I've also had a lot of physicians on there, and so it's a chance to even kind of see like how to talk to folks like this, how to tap into things. So that's called the mindset experience. And then I don't know how many folks are on Instagram, but I am on Instagram at Dr. T underscore sports psych, SPORTSPSYCH. And that also is, you can get in touch with me there and even kind of see how I operate. And again, I think that's been a big source of kind of destigmatizing and making it more relatable and authentic and even more fun. So a lot of athletes will access me through there because they've seen me there and they're like, wait, what's this guy up to? And then they'll hear the podcast and then they'll say, you know what? I want to work with you. And so their entrance to mental health is very different than a traditional entrance, but they were drawn in through like the fitness or through somebody else that they follow or are excited about than to hear, wow, that person gets help or that person knows
That's
Dr.
right.
T. If, that person knows Dr. T and they're, in the NFL or the MLB, why wouldn't I get him? Right. And that's been a really cool thing of like, again, reaching an audience that otherwise wouldn't come to us. So those are all the places people can reach me.
It's great, man. Doing great work. Thank you so much for taking this time and educating us a little bit. And yeah, I'm sure people will be reaching out to ask questions. It's good to have you in the community as a source of support and an expert in the field.
No, and I appreciate you guys recognizing me, and I'm always happy to be a part of this community. It's a really great community. So thank you.
Yeah, hopefully you heal up after your 36-hour endurance event.
I'm good. I'm good. I'm ready for the next one. I got a 50. I have a 50K in 2 weeks, so we'll
Oh,
see.
dear God, we have to go. All right, thanks, man. That was perfect.